Hi, I'm Dr. Sebastian Gonzalez with Performance-Based Sports Care. If you've watched our other videos recently, you're going to see that I'm going through some studies. Not because I'm being lazy about remembering stuff, but it's just because it's the fastest way to get the information to you. So this study landed upon my desk a little while ago, but I didn't know if I would present it or not. Mainly because I didn't want anyone to think I was supporting or bashing either of these types of therapies, which is basically Kinesio Tape versus cervical manipulation. And I'll bring this study up to the camera so you guys can see it and look at the reference for yourself. This is basically comparing the two, the short-term effects of Kinesio Tape versus cervical thrust manipulation with patients with mechanical neck pain. And it's a randomized control trial, or randomized clinical trial. This study, it mainly found that they were equal, roughly equal. And I strongly suggest that you look at this study, and I think that the reason why this is going to be clinically significant to me is because I know that there's a lot of patients that I have that they just don't like cervical manipulation. I don't adjust everybody I see personally, although my trade is chiropractic. It just depends on the pathology and the things that they have. So in this case, they actually suggested that some patients cannot tolerate cervical manipulation, and we should look for alternative therapies. And in this case, they were seeing if Kinesio Tape is an alternative therapy, which in this study it says pretty much yes it is. Now, to compare the two, basically both exhibited similar reductions in neck pain intensity and disability, similar changes of active range of motion, however, except for rotation. They did find that cervical manipulation, or the adjustment, does help out with range of motion, but it was on a very, very minor scale. It was so low in this study that basically they almost wanted to take it out. It was questionable whether it was chance or not. But this study's on Kinesio Tape. It's not on different types of tape like rocktape, KT tape, and so on. I know there's arguments what tape is the best tape. It's not up for debate. In this, I don't really care one way or another. This is mainly on Kinesio Tape. Now, in this study, there were certain things that they did not include in the study. We say there's contraindications to adjusting somebody, such as fractures, osteoporosis, and cancers and things of that nature. Also, they didn't include anyone with a history of whiplash, cervical radiculopathy, which is usually numbness tingling down the arm, or myelopathy, which is a cord compression. Now, in case you're wondering about how many people were included in the study, there was actually 93 people who volunteered, but only 80 were chosen because of some exclusions. So it wasn't an extremely small study, but I thought it was very interesting to see that they were very similar on short-term effects. Now, the theory on Kinesio Tape or these tapes of how they actually work are the following. They said that tape induces changes that may be related to neural feedback provided to the patients, which can facilitate their ability to move the cervical spine with reduced mechanical irritation to the soft tissues. Basically what that means is the soft tissues or the muscles start to chill out and don't become as spasmodic. Also, there's a possibility of afferent stimulus or facilitating a pain inhibitory mechanism, thereby reducing pain levels in the patients as well. So in regards to manipulation, in the past they used to think it was biomechanically, but now they're thinking it's more a result of neurophysiology. And biomechanically means basically movement-based. Now they're thinking it's more of a chemical response. So they found that cervical or spinal thrust manipulation results in a decrease of inflammatory cytokines as well as increasing endorphins. So there's a couple other things on here which were noteworthy about cervical manipulation or spinal manipulation, but I won't go into all that because that would really probably bore a lot of you because it's more in depth than you probably want to know. So again, this study was from 2012 from the Journal of Orthopedic Sports Physical Therapy. And if you want to take a look at it, feel free to do so. I strongly suggest people educate themselves about their conditions, and you'll make better choices of care and decisions in your life in general in regards to medical and sports-related issues if you know a lot about it. So again, to emphasize, I'm not supporting either of these or bashing either of these. This is purely a study that ended up on my desk when I was researching other things for things I have to present on, so I thought it was interesting and I thought I'd put it out there. All right, take care, guys, and if you have any questions or comments, contact me on the P2 Sports Care site or on the thread on YouTube. Share this. I really want everyone to become educated and know as much as they can about their conditions. Take care.